Hi guys, welcome to Getting Epic. If you haven't, please subscribe below so you never miss any of my content. And please leave me comments. I will be sure to get back to you as soon as I can. Alright guys, today we're going to talk about 11 items that I need to do before my open heart surgery. On this channel, you can also learn about me, you can learn about my heart, hypertrophic, obstructive cardiomyopathy. You can also learn about how I plan to get rid of this fat with a heart condition. Let's get into this.
So I am all about being prepared. Back in the day I was a Boy Scout. I tend to overpack, but I want to be ready for anything. So my number one item is write down all of your passwords, every single one of them. I wouldn't just write them down, I would type them out so they're easy for someone to read. I would use Excel, and the first column I'd put the web URL, the second column I'd put your username, third column I'd put your password. I'd print out 2 or 3 copies, and I'd put them inside envelopes, sealed, and hand one to everybody in your family. If something were to ever happen to you, they can open up those envelopes, and they can acquire the information they need. When you think of all the passwords that you have, your social media accounts, your bank accounts, 401k, just logins to pay bills, cell phone, all your business assets if you run a business, just everything that you have knowledge for, they might not know about. And if something were to happen, like they would go into a black hole and they would never know. Item number 2. This is one of those things that I really don't even want to think about. I'm soon going to be 35 years of age. And the item I'm thinking about looking into is creating a will. I do have a 3-month-old and a wife. Having a will will guarantee that my items go to the right people. And so everybody's not fighting over my stuff. Someone can have my computer, someone can have my car. I don't know. But having a basic will would be good, even at age 35. Item number 3, I would put aside money. I would open up a quick savings account, pull some assets aside. That way, if something were to happen or if you were to go into surgery earlier and you didn't qualify for short-term disability at your company, or you just don't have short-term disability options, you have money aside that you can depend on. It will help you relax a little bit more during your recovery. I was told that my recovery can be anywhere from 6 to 8 weeks, maybe even 10 weeks, depending on how I'm feeling. Well, not working for 10 weeks is a little tough to think about. I have a house, I have a family to support, I gotta put food on the table, I have bills to pay. I want to do things in life, I just don't want to sit around and watch TV and play video games. I need money. So if I put this aside, I can still live a semi-normal life, and I don't have to worry about the small struggles. Let me know what you think about that one down below. Is it needed? Is it not needed? I feel like better be safe than sorry. Item number 4, pack a light bag. You're going to bring a bag with you to the hospital. You might as well pack a little bit earlier if you can. We all have these heart conditions. You never know when the ticker is going to just cause an issue and we're going to have to go to the hospital. Well, not only can you be prepared, but this will be the same bag you can bring to the hospital for your surgery. It's going to have just some basic items in it. Be prepared. Don't show up with just a pair of pajamas and a pair of underwear. You don't know what you're going to need, but pack light. If you can't carry it, you shouldn't be bringing it, because you're not going to be able to lift anything afterwards. So if you can't carry this bag out of the hospital with you, don't bring it. Keep it light, keep it simple. Item 5, pack another bag. Leave this one in your car. Give this one to your family. This one will just have some extra supplies in it. Because if you have to stay additional time at the hospital, well, it's going to be nice to have a couple extra clean pairs of underwear. But you don't need to put all this extra stuff in your first bag because it'll just be too bulky to carry around. Remember, you gotta keep things small and light. You're gonna be in the hospital. If you have all this bulky stuff, they move you, something gets forgotten, just watch your stuff. Be safe. Don't bring anything that's expensive with you. Item number 6. This one has to do a lot with your packing of your bags, but it's a complete opposite. This time, we're gonna take off all of our jewelry. We're gonna take off our Apple Watches. We're going to take off anything that's important to us. Why? Because we don't want those sitting around in the hospital. You don't need someone to steal your stuff. Or you don't need to lose it. It means something to you. It's valuable. And there's no need to have it in the hospital. Be safe. Protect your stuff. Leave it at home. Put it in your safe. Item number 7. This is something that's a little extra on my list. I live pretty close to my hospital, but not close enough where under a 15-20 minute drive. It's about an hour and a half depending on traffic. I'm planning on booking a hotel room that's close by for my family. My surgery, it's not the longest surgery in the world. I think it's like between 3 to 5 hours. They'll be sitting in the ICU waiting room, waiting for me to roll out. Not everybody has to be there. If someone wants to go back to the hotel room and take a nap, go for it. That's why I'm doing it for you. I'll be spending the first 1 to 2 nights in the ICU, depending on how my conditions are. No one can stay in the room with me, not even my wife. Having them close by, if I need to call them, if I need something, they're close. They don't have to jump in a car, drive, sit in traffic. If something were to happen to me, they're right there. That's just that peace of mind that I want to be able to share and give to my family. It's very little, and I'm thanking them right now for sticking around and dealing with all these issues with me. I have the best support system. The only way I can find a way to de-stress is to make these videos. Item number 8. Schedule a pre-op appointment. Don't just show up and have your surgery. Go meet your doctor. Write down a huge list of questions before seeing the surgeon and doctor. That way you don't freeze up and you know everything before going in. To be completely honest, I watched a couple of YouTube videos of my surgery. Complete open heart surgery from start to finish. And holy crap, yeah. It's a little scary because that's going to be happening to me. But seeing how it's done, it's kind of desensitized me. So I'm a little less worried because I know what's going to happen. I'm not scared because it's like, ooh, they're going to cut me open and they're going to take something out of my heart. What does that detail? Well, watching that video and seeing how much care they give to the patient just makes me feel good. I am in good hands. So let's see what happens. Item number 9. Man, we're getting up there, huh? So this one is your dentist. Because you're having open heart surgery, after the surgery, you can't really see the dentist for about 6 months, I think. It might even be even longer than that. Because if something were to happen and you were to get infection inside your mouth, that could actually lead to your heart and just kill you. So we don't want that. You need to go see your dentist beforehand, get checked out, get all your dental work done now. Once everything's all set, make sure they sign off a piece of paper saying they approve you doing the surgery, that you're ready to do the surgery. And the hospital might even ask you to provide this information for them. Another thing to do, another appointment, sucks, yes, but this is your heart. You need to live, and you need to live a long time. Item number 10. The hospital that you're going to be getting the surgery at, they might require you to get blood work. Here's another appointment you have to go make. Just go down to your local hospital, call them first and make sure they accept your insurance. I recently did this. I went down to my local hospital, walked in, handed them a form, and they drew like 3 vials of blood, and they sent it off to my hospital where I'll be getting the surgery. Hopefully my blood's good and I can move on with the surgery and there's nothing that's going to be a blocker. Because I think that's my biggest fear, is having a blocker and not be able to have the surgery because something's elevated. Item number 11. This one's even scarier than writing down your passwords or creating a basic will. This one is actually signing off on a healthcare proxy. A healthcare proxy essentially will make the decision when you can't. So usually you're out, you're knocked unconscious, you could be in a coma. And this person will make the ultimate decision. What happens with your healthcare? Do they do this or do they do that? This person will make that decision. So make sure you trust them and that they know you really well. And make sure you can pick someone who can actually make that ultimate decision if it comes down to that. But also be sure to reach out to this particular person and let them know what you would want to do. Because if they don't know what you want, then they can't tell the doctors what to do. I want to live, but if I'm brain dead, then I don't know. It's not really my decision at that point because I can't even think. It's scary to think about, but I don't know. Alright guys, that's a wrap. There's 11 things to do before your open heart surgery. I hope your surgery goes well. Mine's right around the corner. So, starting to do the real freak out, so maybe I'll be pumping out more videos, who knows. Thank you for following me. If you're not following me, please log into your Gmail account and hit that subscribe button. So that way, any of my future videos, you aren't missing out. If you haven't, please leave me a comment below. Let me know if maybe you have some additional items that I didn't put on my list that you're doing. So that way, I can maybe do them too. Yeah. Alright guys, well, thank you again, and I hope you guys have a great day. Alright.